So are there any, just out in the field in general, are there any like double-blind controlled peer-reviewed studies out there on this subject?
Absolutely. And a lot of those are in the book.
All right, awesome. And then one thing I think that a lot of our the people in the audience are concerned about, like the specific type of signal that has gotten a lot of people motivated to take action is 5G. What are your thoughts on the dangers of 5G? Is that something uniquely dangerous, or is that just a part of this fog of electromagnetic?
It's just stronger and faster. So again, these EMFs were designed for communication. They were not designed for healthcare. And in many ways, what I'd rather do is focus on the value of PEMF therapy rather than the risks. So you could have 5 hours of discussion on the risks.
Mm-hmm.
And 5G is bad. 10G is worse. So, and the 5G is worse than 4G, worse than 2G because of distance. So now what has to happen is, because you've increased you've decreased the wavelength of these Wi-Fi signals, that means that they have to be, in order to broadcast them at a distance, you need a lot more power. And that's why you see 5G stations all over the place, because they need more power to be broadcast. 10G is going to need even more. So 5G is no different than the others, except that it's more proximate to us, closer to us, and the amount of absorption by the body is greater, except that the amount of absorption here versus here is going to be quite different. So if I put it like on top of my head up here, it's going to be very different there than it is there. So if the 5G tower is this far from you, there's relatively little risk. I'm not saying literally physically, I'm just showing you a representation of distance.
Sure.
So the closer you are to the 5G, the more risk of harm there is. The farther you are, the less risk. So it's not just about the fact that it's 5G, it's about the intensity and the distance and the duration of exposure.
So what are the types of things? I know you gave a long list of things that can be treated with the PEMF therapy. What are the things that most people are coming in for? What are the things that you've had where people come in and they've had the biggest and maybe most surprising benefits or health rehabilitations from? So
I showed you there's two patients or people who consulted with me. One was a 30-year-old and one was a 70-year-old. So these are fairly typical of the people who look for advice for PEMF therapy. The most common reason for people to seek PEMF therapy is pain. 60% of visits to doctors, primary care doctors, are for pain. Right? Pain is the most common reason that motivates us to move. Being short of breath, it depends on how short of breath you are. If you're running up the stairs and you get short of breath, you're not going to go to your doctor. Right? If you're short of breath sitting in your chair in your living room, then you better go to the doctor. So really, it's the motivator that drives people. Now, as I mentioned, with all these different tissues, all these different problems the people have in their bodies, all these functional physiologic changes, all can benefit from PEMF therapy. So what's the threshold at which people are willing to spend the money and the time and the effort to get a PEMF system? So pain becomes the most common. And the challenge with pain is that we don't want to just remove pain. We don't want a Band-Aid. If I give you ibuprofen, it helps your pain, and you might be happy for a little while, but it's going to come back if you don't remove the cause. So the goal with PEMF therapy is to try to heal the cause as much as you can, and that means you're going to have to put in the time to do the healing work. Right? We didn't put in the time to do the healing work at the time of the original injury, or sometimes the original injury was just too bad, too severe, and where it affected the body was such that there's no way that you could have done anything about it. And how fast could you have eliminated the pain problem from it? So when does pain become chronic? It depends on a person's definition. Certainly at least within a month or 3 months away from the original insult. After that, it's chronic. So then how long is it going to take to heal it? I showed the slides of the different healing rates of the different tissues. Right? So that's all very important. And that's in the book, both books as well, the healing timelines. So pain becomes the most important. And again, you got to give the body a chance and time to heal. If you get recovery from your pain very quickly, God bless. But you're not done yet.
So I've got to ask this question because of I guess the type of system in the United States we have to pay for therapies. Do insurance companies cover any of this? Do they acknowledge that it even exists?
So there are magnetic therapy devices that are approved by the FDA and can be covered by insurance. So for example, there's a system called TMS, transcranial magnetic stimulation, that's been FDA approved for depression. And I would say most insurance companies in the US today now cover that in a limited way for a limited number of treatments and only for treatment-resistant depression. There are devices that are approved for healing fractures that won't heal, non-union fractures, right? And they've been around for 25 years. But the company will not allow you to buy the machine unless it's just for a non-union fracture. And those machines have a time clock on them. They're only good for a certain period of time. They go beyond that time, you have to apply back to the company and say, and the doctor has to apply back to the company and say, my patient needs this longer than what you've allowed it to be used for. Generally speaking, non-unions will repair with this device within 3 to 9 months. So usually people are done with it after 3 to 9 months, but you can't use it for anything else. If you get seizures or you have migraines, you could, while you're using it, while it's working for your fracture, you could use it on your brain, but then you're using up the time that you have available for your fracture. So you have to decide which is more important. Now, if you healed your fracture and you still have a clock on it, well, you could probably use it for other things too. It's a very weak magnetic field, but it works, still works.
Okay, we're going to take a question from our audience. Bin Wu, please state where you're from and ask your question.
Yeah, hi, hello, good morning. Can you hear me now? You can hear me?
Yes, we can.
Oh, yeah. And this topic is so interesting. It's so great for the medicine to treat the patient. So I got one question. I know another question is how can people find the best vibration for the health? Another question is if people work on the phone all the time, so do you think they will get some disease from the phone all the time?
All right, if I understand your questions correctly, first question was, well, what devices are best for you for your given problem? And there's I'll have a slide still up there about the websites. So drpawluk.com is probably the best source, or you could get the book Supercharge Your Health, which is only about $29. So you could read through that and that'll give you a lot of information about what devices to get for different problems. I hope I answered that question correctly. The other one is the people with phones. What's the best way to protect yourself from using your phone all day long? I go back to that question. That's a very important question. It's a good question, and it's a tough question, because is the only thing you want to do is to treat your brain? If that's the only objective that you have, to treat your brain from the damage caused by the phone or potential damage caused by the phone, then you can get devices that only basically treat the brain area. But you could spend anywhere between, say, $400 or $350 upwards of $10,000 for treating the brain. Now, if you're just doing for protection purposes, you probably don't need a whole lot of magnetic field intensity. But in order to treat across the brain, protect the whole brain from magnetic field therapy for 15 Gauss. In other words, you need 15 Gauss from one end of the brain to the other to protect you from the inflammation caused by the phone. You need a 4,000 Gauss magnetic field machine. And the value of that is that if you have a 4,000 Gauss magnetic field machine, it's going to do a lot more for you than just protect your brain. You can get all the other benefits of magnetic field therapy. It's not a one pill for one problem kind of situation if you think about the way magnetic fields work. So you have to think about, again, what benefits do you want for one particular problem, but what other benefits can you get as well? And again, all that information is on drpawluk.com. I think one of the problems that we have is we have to stop thinking like the pharmaceutical industry. One problem, one pill. 10 problems, 10 pills. 10 pills, 20 pills to offset the side effects from the 10 pills. Right? We have to stop thinking that way. We have to start thinking largely about our bodies. And it's not just our brains that need protection. At the same time, you're living and breathing. Your heart's pumping. Your joints are working. Your muscles are working. You have inflammation. You have a bad tooth. You have inflammation. You have sinuses, or you have allergies. You need to treat you, not just your brain, not just protect your brain from the cell phone.
Great. Thank you for that, Doctor. So you had mentioned hands-on energy treatment. Reiki has become very popular in the West. You know, there's a lot of yoga studios and people, you know, Reiki practitioners going on there. What are your thoughts on the power and the efficacy of Reiki?
I'm trained in Reiki myself. I'm trained at the master level for Reiki. And, well, if your only tool is a hammer, you see every problem as a nail. If your only tool is Reiki, then, or acupuncture, or a chiropractic, it doesn't matter what it is. If your only tool is a hammer, you see every problem as a nail. And Reiki can do a lot of things for a lot of people. But I have also found that Reiki doesn't work for a lot of people, probably a lot more than it helps. And where I find Reiki is probably the best value is people with sort of minimal early problems. They also have to be willing to accept the value of Reiki, right? With cancer in particular, I tell people that your cancer is between you and God. Any disease, any condition you have is between you and God. Right? You need to have spirit helping you as well to deal with that problem. And Reiki works at that level of bioenergy, but it's very weak bioenergy. So it's working not only on the bioenergy from the healing process that's going on with you, with the healer, but it's also working with your belief system and your values and beliefs and your spirituality. So if you got a spike in your skull, Reiki may help you feel better. Is it going to take care of the spike? Is it going to take care of the damage from the spike in your head? I would say, as a physician who has been trained in all these things, I would say, no, you have to get off the edge of the cliff in a gale, in a wind, high wind. Then you have to find out how you got on the cliff in the first place and deal with that. So Reiki can be very useful, but I think it's relatively subtle. And relative to PEMF therapies, I put Reiki on the spectrum of value, but from a physician's perspective, if you got, again, a head injury, if you have COVID, if you have so on, then Reiki energy medicine approaches, Tai Chi, Qigong, all of these things can be very helpful. Studies have been done actually using what's called a voltage wall for healers, including Qigong healers. And a voltage wall is you got a copper wall and you can measure electrical potentials. And so they took these healers and they were broadcasting their like Reiki or other healing approaches at the wall. And what they found is that their brains lit up and produced a significant amount of energy in the brain. And then all of a sudden there was a discharge through the hands or the body of the healer onto the wall. And they could produce as much as 1,000,000 volts. But they were unpredictable. They couldn't do it consistently and they couldn't do it all the time. So there's a value, but there's a problem of reliability, durability, persistence, consistency, and so on. So again, they can have some value, and it depends on the problems you're trying to deal with. If you wanted to sort of generally support your psyche and your spirituality, I think it makes a lot of sense to do that. And maybe for maintenance purposes, it seems a lot to do that. If you have a spiritual crisis going on, if you're depressed, if you're anxious, then yes, these technologies could be quite effective because they're not only working on the energy patterns, they're also working on your psyche. And so your belief system has to be engaged for all of that to happen. So that's sort of my answer, having experience with all of this.
All right, great. We've got another question from Bin Wu. Bin Wu, go ahead and ask your question.
Yeah, thank you very much. It's very interesting, the science. And one question is, first, is the mind vibration? So the positive mind has the positive vibration for body. This is true or not? Second one is, does any food have vibration to support the body health vibration.
Okay,
Food has vibration too.
I think you said vibrations. So vibration, again, we go back to frequency versus intensity. Right? So frequency, vibration is frequency. All the cells in the body produce hundreds and maybe even thousands of vibrations or frequencies at any given time. I use PEMF therapy. Talk about vibration therapy. I use PEMF therapy to help people to sleep. We have a device called the X-Pulsor that we put on a pillow to be able to induce the brain to vibrate at a lower rate. So a brain that's vibrating like this is awake. A brain that's vibrating like this, a pulse per second, is asleep. So we want to induce that vibration in the brain. That's called entrainment. So that's using frequency. That's using a pulse rate to induce a frequency in the brain. We are so full of frequencies. It's so hard, as I mentioned at the beginning, it's so hard to know what frequency is going to work. And all you can do is try it and see what it does and what it doesn't do. And what it doesn't do, I think you better find something else, another solution for it. All food has frequencies. But those frequencies, when that food is broken down, so a melon has a melon frequency as a whole melon, or let's say a lemon. And then you take off the peel, the frequency changes, right? So the peel has its own frequency. And the food has its own frequency. And the juice has its own frequency. So all of these frequencies are additive. And because a melon or a lemon has many thousands of frequencies, what is it doing in the body? It's interacting with the body, the other frequencies in the body that are sympathetic to that frequency. But is it strong enough to take away a headache? It may be, it may not be. If you have a migraine and it's shutting you down, it's probably not going to be strong enough. If you're trying to prevent migraines by using lemons, you may find that maybe on a regular basis, taking lemons decreases the rate and the severity of your migraines. Try it and see what happens.
Great, thank you for that. So we have about 2 more minutes. Let me just ask you a question on grounding. Given that we're bombarded with all of this, this electrical magnetic interference, what are your thoughts on people walking in nature barefoot so they can be grounded? Put that out.
Yeah, I had a discussion with Dr. Mercola about this, and with several other people who have large audiences. And what I told them is that the idea behind grounding is an excellent idea. And it does attach us back, in a sense, to the earth. But it does boil down to energy. It does boil down to charge. And so grounding essentially grounds you to the charge of the earth. Right? If grounding was that good, if grounding was that important, if grounding was that effective, why did people only survive 30 years or about 100 years ago? They didn't have electromagnetics. They didn't have Wi-Fi. They didn't have anything else. They lived on the earth. They walked on the earth all the time.
Okay.
Right? So grounding has a value to a point. If you're dealing with a serious or significant health issue, if you want to use grounding for just maybe helping you with your sleep or just general balance or just generally feeling a little bit more sort of grounded, then grounding is good. But if you got pneumonia or if you have a broken bone, grounding is going to only go so far. It's not going to be enough.
Great. Thank you so much. We're going to end our Q&A there. Thank you so much for all the amazing information that you shared today. And just so that everyone else can share their appreciation with you, we're going to open up the mics and you'll hear a cacophony of thanks from the audience.
Thank you very much.